Visual hallucinations are probably one of the most devastating symptoms that we see in the diseases that I treat and research, especially in late stages of Parkinson's disease and the early stages of Lewy body dementia. Visual hallucinations sometimes aren't that threatening, but they're disturbing and they're a signal that there's something going wrong with the brain. The problem as well is that they often go hand in glove with delusions, psychotic behavior. I think someone's breaking into the house. I think my wife's having an affair. I think someone's stealing my stuff. The repertoire is very limited in the diseases that I tend to see. So really what I wanted to do with my research was try and appreciate what was going on with visual hallucinations, and then maybe, importantly, steer ourselves towards some treatments, because at the moment we have precious little that can help. The work that I've done through our research clinic has been fantastic. The amount of data we've been able to get out of our patients has allowed us to see what are the things that are associated with with visual hallucinations, but also to work out what it is that might predict who will go on to have visual hallucinations. Because if we could find things that we may be able to intercept, we may be able to better treat them. And that's been some of the work that we've already published. I guess in the research world, one of the things I'm more famous for than that even is coming up with a hypothesis of what's actually going on in the brain with visual hallucinations. And I had a look at what was going on with the circuitry and what the data was, and came up with something that I thought may represent why someone gets visual hallucinations. And then realized that we had to be able to test it so it was useful. And that's when I was able to come up with a new paradigm, a computer test, where we were able to actually simulate hallucinations by getting people to look at images and seeing what they could see. And our patients with hallucinations clearly had a different performance on this task compared to those that didn't. And when we got that piece of information, what we did next was we took that test and put it into an MRI scanner, where patients could lie in the MRI scanner having pictures taken of their brain while they were doing the task. And again, we were able to show which parts of the brain weren't working properly, and interestingly, they supported the hypothesis that we'd put forward as to what might be causing those visual hallucinations. Recording changes on a brain scan triggered us to think, well, maybe there are other ways of recording these events, like electroencephalography. So this is the idea like EEG, like the epilepsy doctors use to record epileptic attacks, but the idea of putting maybe just a few electrodes around the head so we could actually monitor the brain's activity and see whether we can predict what's going on with a hallucinating episode. And we are getting the results now to show that we can capture those attacks, and what we're doing next is looking at how we can predict them. Having that information is great, but of course what we really want to be able to do is to treat these symptoms. And that's a much harder thing to do. People think of treatment and they often think about medications, and the development of a medication for hallucinations is something that people are considering. And in our clinical trial space, there are companies out there that have approached me about getting involved in these trials. They've yet to come, but I think that we are going to see more of that in the future. One of the other ways that we are trying to alleviate hallucinations is by the idea of maybe stunning the brain. People will be familiar perhaps with the technology of transcranial magnetic stimulation, and this is where people use a probe held over the head that puts a magnetic field into the brain tissue, disrupts the circuits. A more less invasive way, I should say, or perhaps easier way for us to disrupt those circuits might be to continuously pass a small current through areas of the brain. And this is something that my team and our collaborators, some very, very clever people working with us, are working on now, which is a way of how do we get a trial together where we could see if we can disrupt the circuitry of the brain and, if you like, reduce the amount of hallucinations and those phenomena that are going on in patients. As I say, I think we're on a journey, and I'm most grateful to those patients who come along and help us with our research. So thank you.